In modern medicine, some of the most critical moments happen right at a patient's bedside. But here's the thing. The biggest challenge is getting a clear picture of what's happening inside the body of someone who is just too sick, too fragile to be moved. So how on earth do they do it?
Right. That's the big puzzle, isn't it? When a patient's condition makes that trip down to the big radiology department a massive risk, how do doctors get the vital images they need to make split-second, life-saving decisions?
Well, the answer is actually kind of brilliant in its simplicity. You don't bring the patient to the machine, you bring the machine to the patient.
And we call this bedside radiography. It's something that's specifically ordered when moving a patient is just too difficult or, frankly, too dangerous. It's an absolutely crucial tool all across the hospital, from the ER to the ICU.
And this is the machine that makes it all possible. This mobile unit right here is the hero of our story. It's a super sophisticated X-ray generator on wheels, and it's capable of producing amazing, high-quality images in some of the most challenging environments you can imagine.
All right, so our journey begins in a place where patients are probably at their most vulnerable, the post-anesthesia care unit, or the PACU. This is the recovery room, right outside the operating room, where patients are just waking up and are not quite stable yet.
See, immediately after surgery, doctors need answers, and they need them fast. Did that central line go in correctly? Is there a complication, like a collapsed lung? Is that brand new artificial joint sitting exactly where it's supposed to be? Bedside X-rays give them these answers right then and there, without having to move the patient at all. And check this out. This is a perfect example. This is an X-ray taken right there in the recovery room, giving the surgical team immediate visual confirmation that this hip replacement is perfectly placed. That is a critical check before the patient can move on to the next stage of their recovery. Okay, next up, our journey takes us to an even more intense environment, the emergency trauma unit. This is a place where the stakes are way higher and every single second counts.
A trauma bay is like a whirlwind of organized chaos. You've got a whole team of specialists working on the patient all at the same time, trying to stabilize them. The absolute last thing you want to do is interrupt that life-saving care. So the mobile X-ray unit has to just weave its way through this flurry of activity to get the shot. Now, listen to this, because this is so important. For patients with suspected spinal injuries, they are completely immobilized. Moving them could be literally catastrophic. This type of mobile scan allows doctors to assess all kinds of injuries to the spine, the chest, the pelvis, without risking any further damage. It's a total game changer. So, from the controlled chaos of the trauma bay, we now enter the quietest, most delicate environment in the entire hospital, the neonatal intensive care unit, or the NICU. The challenge here is just immense. These premature infants have to be kept warm and protected from any kind of infection. So the entire procedure, the whole X-ray, has to happen inside their enclosed incubator, which is like this climate-controlled safe zone. You can't just open it up, you have to work with incredible precision. And the protocol here, it is so strict. Everything, and I mean everything, gets disinfected before it even enters the room. Hand hygiene is flawless. The nurse, who knows that baby best, helps with every tiny little movement. And of course, the radiographer uses the absolute lowest radiation dose possible to get the image. It really is a masterclass in careful, compassionate care. And now, we arrive at the climax of our journey, the intensive care unit. This is, without a doubt, the most complex and challenging environment for any bedside radiographer. I mean, just look at this. The ICU is this dense web of life support technology. Every single wire, every tube, every pump and monitor is doing something critical, something life-sustaining. And the radiographer has to navigate this whole technological maze just to get one diagnostic image. The obstacles are everywhere you look. First up, the patient's own chest is covered in all these ECG leads and other monitors. You can't move them, so they're definitely going to show up on the X-ray. Next, you got to look down at the floor. It's an absolute minefield. You see these? These are chest drainage units. Tripping over one of those or just bumping it could have really severe consequences for the patient. You have to watch every single step. And finally, there's just this sheer tangle of tubes, IV lines, ventilator tubes, catheters. It's a whole web of plastic and wires, and every single one is keeping that patient alive. One wrong move could be disastrous. And this really drives the point home. The source material warns that accidentally pulling out one of these lines isn't just a mistake, it's a common and incredibly dangerous error.
The stakes just could not be any higher.
So, after navigating this high-wire act, what's the result? What does the radiographer get that makes all this risk and all this precision so worthwhile?
This right here, this is the aha moment. So on the left, you see a simple diagram of a chest tube draining the lung, and on the right, that's the actual X-ray taken at the bedside, and it shows that tube is exactly where it needs to be to work. This image is the definitive proof that the treatment is doing its job.
And here it is, the final product. And yeah, it looks pretty noisy, right? You can see all those external lines and wires, but a trained radiologist, they can look right past all of that clutter. Their expertise lets them see the critical information underneath, the state of the lungs, the position of the catheters, the condition of the heart.
So what's the big takeaway here? Bedside radiography is this unseen but absolutely essential pillar of critical care. It provides those vital checks on treatments, it helps diagnose life-threatening changes in a patient's condition, and it does it all while protecting the most fragile patients from the very real risks of being moved.
It's a practice that combines incredible technical skill with just amazing situational awareness and care. So the next time you're watching a medical drama on TV, keep an eye out for that unsung hero, the radiographer carefully wheeling their mobile unit into a crowded, critical room, because now you'll know the incredible journey they're on.